one of the things that I'm really passionate about is children's health. I adore, love, I'm passionate about the amazing things that can happen when you pour goodness into kids and they become the healthy adults they're supposed to be. So my premise today is one that I've carried since I became a pediatrician, which is an unwavering belief that the way to improve health, specifically here in Texas, is to improve access for primary care for kids. The reason I say this is somewhat humorous, but real. So who here has seen Benjamin Button, or the mysterious case? Other than this fictitious treatise of Benjamin Button, there has never been an adult born, not going through childhood, with heart disease. Here I am, I'm a 66-year-old with heart disease. Congratulations. That has never happened. What happens is you have a child that's born, that child grows up in a family, a community, and has experiences that promote their behaviors and their exposures that then lead them to become a 66-year-old with heart disease. So what would primary care look like if down the road, before they ever became adults, before they were teenagers, when they were first born, and all the way through the years, we provided the primary care, the needed, necessary support and services that kept them from becoming that 66-year-old with heart disease. Or if they were predisposed to being that 66-year-old with heart disease or with diabetes, that we made them the healthiest possible 66-year-old that they could be. What would that look like? For me as a pediatrician, it looks like providing improved access to primary care for children. I'm going to talk to you about the financial and administrative burden that it takes to be a pediatrician and a primary care pediatrician here in Texas. I just opened my practice a month ago, so this is fresh in my mind, and I've spent most of my career as a pediatrician either in primary care leadership or running a practice. So this is something that I'm really thinking through and thinking of how we are different about how we process primary care for kids and how we really provide the incentives and the innovation to make primary care for children a better way than it is right now. So in my area, I'm actually one of a scarce few pediatricians who still accept Medicaid. I come to Medicaid because 1 in 3 children, and I want you to understand that statistics, 1 out of every 3 children is a Medicaid beneficiary in the state of Texas. 2.8 million children rely on Medicaid for health insurance. So as pediatricians, we are fully poised to provide primary care to this population of kids. Yet, many pediatricians do not accept Medicaid. And I'll talk to you about that financial and administrative burden and the reason they don't accept Medicaid in just a little bit. First, I want to speak about an adorable 6-year-old that I met about 3-4 weeks ago. She was actually my first patient. I'll call her Jenny just to protect the family's confidentiality. So Jenny is a 6-year-old. She has asthma. Until they joined my practice, the family was driving 2 hours round trip to get primary care for Jenny. 2 hours. That's the time that it takes you to go from Dallas, where I live, down to probably about Waco, if you were driving at the way that I drive. But it's a 2-hour drive. That's a significant drive for a family with a young child to drive. And what happened is Jenny had a respiratory flare. So she has asthma, she had a flare of her asthma, and she's wheezing and she's having trouble breathing. Not sick enough necessarily to go to the emergency room, but she needed urgent primary care. She needed to get to her pediatrician. And the parent's choice at this point was to drive an hour one way with a sick child in the back seat to go to urgent care, or usually what happens, to go to an emergency room for primary care asthma care. Luckily for them, they had seen an ad and they said, oh, there's this new pediatrician near us, let's go there. And they came to my office and I was able to see them and I was able to manage her care, and over the course of 24 hours, she was bouncing and happy and smiling and her usual self. And we saved an urgent care visit, we saved an expensive emergency room visit because I'm willing to take the risk. But it's not a realistic and a sustainable prospect to say to every pediatrician, go ahead and take that financial and administrative risk that is Medicaid. Go ahead and do it. We know that Jenny's parents are excited when they get their Medicaid card to say that she is not one of the 740,000 children in Texas that are uninsured. We also know that when they read what the Texas Tribune wrote last November, saying that Texas has one of the highest number of uninsured children in the country, that they were excited. They said, oh my gosh, we have a Medicaid card. Our child is not uninsured. This is wonderful. But guess what? That card didn't mean access. It's not that the family loved the scenic routes to drive 2 hours. They didn't feel like driving 2 hours. What happened is that they passed dozens of experienced and qualified pediatricians on their way to their prior PCP, and those pediatricians didn't take her Medicaid. They didn't take her insurance. So the card was essentially ineffective because she didn't have access. Now, in Texas, we know that we still have some of the highest population of children in the country. 1 in 9 children calls Texas home. We also know, as I shared, that 1 in 3 children are on Medicaid. Well, one of the things that always gets me fired up about being a pediatrician is no matter what state you're in, no matter the population, how many kids are in there, you're gonna find that anywhere from 30 to 40, in some states, 50% of the kids in that state are on Medicaid or CHIP. They are relying on government insurance in order to get primary care services, the basic and most basic services that there are. What you find is children who are on Medicaid and individuals on Medicaid as a whole are at risk for social inequity, and that social inequity is really the foundation of a broken social structure. So you will see physical and sexual abuse, you will see physical and emotional health issues, you will see mental health conditions, you will see homelessness, food insecurity. As pediatricians, we can't treat an ear infection and ignore a hungry kid. We can't do a sports physical and ignore medical neglect. We can't even manage diabetes and ignore the fact that this family is homeless. We manage all of it. And when we see children on Medicaid, we know that we are seeing socially complex children and that we will take care of acute illness, chronic illness, homelessness, abuse, neglect, unemployment, illiteracy, et cetera. We take it on. It is hard but fulfilling work because when you are able to support a child through everything, through all their experiences and help them become the healthy adults that they can be, that is the reward of being a pediatrician, and we do it. But that type of care is expensive care for us as practices. So the pediatric practices are taking on a cost that Medicaid doesn't compensate us for. And what you find is a lot of pediatricians are saying, this is not a viable option for me as a practice. I can't do this really expensive care, not get compensated for it, and keep my business going. And that's why they choose not to accept Medicaid. It's not magical. I'm not this wonderful angel. It's that it's a risk. It's a financial risk. It's an administrative risk, and they just can't take that risk, and they opt not to. And when they opt not to take Medicaid, what that means is 2.8 million children, 1 in 3 children, don't have access to primary care or have extremely limited and unrealistic access to primary care. So how do we solve this? How do we figure out the way to make this better? Well, if we want to improve primary care in Texas, there are 5 things that really come top of mind, and you'll hear these over and over if you read about primary care access, especially for children. The first is fair and consistent care coordination reimbursement. We have to coordinate care. We have to make sure that the social determinants of health that are impacting that child's health, that we are addressing them, and that we are also looking at the infrastructure of what that child is in, whether it's their community, their schools, the support systems, and that we're coordinating everything to help that child be the best that they can be. And that needs to be reimbursed fairly. The second is Medicare, Medicaid parity, which means we need to give primary care pediatrics the value that it brings into the lives of children. We need to pay for primary care pediatrics the same way we pay for primary care adult care or any other care. The third is decreasing administrative burden. And what that means is pediatricians are trying to get the best care for their kids. And we need Medicaid to support that so that it's not so hard. We cut the red tape in order to get the best care for those kids. End the churn. You'll hear this, and it's probably all over Twitter. End the churn. What that means is we need to know that families and children need to know that they have continuous, consistent, and reliable eligibility for Medicaid year in and year out, and they don't have that fear of dropping off the cliff of Medicaid and losing access in the most traumatic of ways. And finally, probably most importantly, is to incentivize primary care innovation. Pediatricians are doing some amazing things to support and improve the health of their kids. They're doing virtual consultations with specialists so kids don't have to drive far distances to get to a specialist. They're doing home visits. I do home visits, telemedicine, remote patient monitoring, a multitude of things that really go to improve the health of those kids. And most of these things are not reimbursed, but we keep doing it because we know it's going to improve the health of our kids, and that this is really what moves the needle for child health. It's time for us to really prioritize primary care children's health. To me, for Texas, in the next 10 years, the way we do this is to look at the way that we pay for Medicaid reimbursement, the way that we incentivize innovation in primary care, and the way that we prioritize children as a whole in Texas, because outside of Benjamin Button, we're never going to see an adult that didn't start out as a child.